Stephen, this is a very rare presentation in which one of the ribs appears to be elevated, coupled with a lack of inferior mobility. Let's put your hands on both sides. Good. Okay. So you can see the outline of her scapula here, okay? And it's probably rib number 4. And as I put my thumbs on both sides symmetrically and I dig deep, so I get partially above each rib, I'm comparing side to side. And I continue that. And then I come to this one, and there's a significant difference. This is elevated towards her head, okay? And then we come above that, and I find symmetry. Now, it's not real important how things look. It looks elevated. Does that mean it's elevated? Don't know. The most important thing is to test motion. So what I do is I'm inside that scapula, about an inch inside the scapula, and I use the outside heel of my hand, and I push towards her foot. So I push to take up the movement that's easy. That's called taking up the slack. And then I thrust it. And you can see that this rib has inferior joint movement. Okay? Now I slide my hand a ½ inch below that, and now there's no movement. I can't take up the slack. Not able to get inferior glide motion. I come a ½ inch below that, and now I can take up the slack, and now I can spring it. So the treatment is really simple. It's just to capture that tight rib, okay? And so I'm capturing it with the outside of my hand, and then I'm stacking my hands, and I just gently push towards her foot. And you maintain that force for 2 minutes. So I'm going to set the timer. I'm going to treat it like this, and then I'll come back and I'll film the results. So I would like you to treat her once a week for 6 weeks. You can do it more often. You can test her a couple times a week. If it's not tight, then there's no need to treat. But yeah, if you would test her at least twice a week, and if it needs treatment, then you lean on that gently for 3 minutes. And do that for 6 weeks. Thanks.